Welcome back. Despite recent FDA approval, some new Alzheimer's medication that has shown it can slow the progression of the disease is not accessible to many Americans. And that is because the Center for Medicare and Medicaid Services, or CMS, has limited coverage eligibility for the treatments.
Erie News Now Washington, D.C. correspondent Brendan Scanlon spoke with advocates who are looking to get the new promising treatments.
More than 6 million Americans are living with Alzheimer's disease, and that number is not expected to decrease anytime soon.
Over the next 2 decades or so, it's going to more than double.
As the number of Americans living with Alzheimer's grows, so does the cost for the U.S.
We spend, collectively about $355 billion a year to manage and treat Alzheimer's.
Last July, the FDA approved 2 promising treatments to slow the progression of the disease
That have come through their process that they have found to be safe and effective, and also to reduce the buildup of plaque in the brain, which is sort of the hallmark of identifying dementia and Alzheimer's.
Dr. Ken Thorpe with the Partnership to Fight Chronic Disease says the recent approval is great news for treating early onset dementia, but the bad news is the treatments are only covered by CMS if the patient is enrolled in a clinical trial.
This is unprecedented and highly unusual for a public program like Medicare to not reimburse for an FDA-approved medication that's shown, tremendous clinical progress.
Thorpe says the decision impacts future innovation for chronic disease treatment.
This decision could really hinder the incentives to innovate.
He says slowing the progression of Alzheimer's reduces the burden on family caregivers and can lower costs across the board.
To reduce the number of months that a patient is in a memory loss center or skilled nursing facility, which saves the patient's family money and will save Medicare money on the nursing facility side.
Reporting in Washington, Brendan Scanlon, Erie News Now.